On the day of surgery with a breast reduction, you'll come into hospital, the nurses will admit you, you'll see the anaesthetist, you'll see me, and then I'll mark you carefully. So the real marking of the reduction is done on the day of surgery just before you go in. So you'll be awake, non-sedated, able to talk, you'll be a little anxious but hopefully okay. And I'll carefully plan your breast surgery out when you're standing, and then I'll photograph you. I like to refer back to my markings later just as a quality measure really. Then you'll go into the operating room. You'll have an anaesthetic, and once you're anaesthetised, I'll inject your breast with 1 litre of dilute local anaesthetic and adrenaline solution, just as we would for liposuction. It completely cuts down on blood loss, makes it much more minimal, creates good analgesia or comfort for you after the surgery. So it's a really good thing to do. I'll then do the surgery, which takes usually between 2 and 3 hours, depending on the breast size that you have and how much lipo there is. And then at the end of it, I'll sew you up with buried dissolving stitches that you won't ever see, and which just dissolve away in time. Then there's plastic dressings put onto the wounds, which are terrific dressings, and they stay for a couple of weeks, but they allow you to shower. I don't use drain tubes. It would be very rare for me to use drain tubes. Haven't used drain tubes for 15 years in breast reduction. Don't see the point. Really careful stopping of bleeding during the surgery is the key. At the end of it, an elastic crop top called a tuber grip vest will be put on you with some paper pads, and you'll then go to recovery and then back to the ward. Reasonably comfortable. You'll be up and around, able to go to the bathroom within a few hours of breast reduction surgery. Most people stay one night in hospital, some people go home the same day, which is fine. But in general, if you can stay overnight, you'll have a better experience, and the next morning you'll go home. Post-operatively, people don't usually have terrible pain with breast reduction. If you have terrible pain, I want you to ring me. It may indicate a problem such as infection or bleeding, although both of those are pretty uncommon. But you will be sore, and you'll feel stiff and sore like you've been run over, had a minor car accident kind of pain. And this creates, due to the fact that you get bruising in the tissues. Most people need strong painkillers for no more than 1 to 3 days, and after that paracetamol, Nurofen and these types of things for 1 to 2 weeks. So the recovery from a breast reduction is not horrendous.